When we think about healthcare disparities, we think about preventable differences in patients' access to care, level of treatment, opportunities for optimal health. Now, with CCCA, which recent research has shown us has a significant genetic component. So the fact that CCCA is more common in Black women in and of itself is not a disparity because that's not preventable. That's genetic. However, what I do see in clinical practice is a significant delay in the diagnosis of this condition. I also see a significant delay in treatment for this condition. So what does that mean? Well, it means that sometimes people see 2 or 3 or 4 different doctors before they even get to someone who makes a diagnosis. This sometimes happens because hair loss gets poo-pooed. Oh, it's just hair loss. We've got to worry about your hypertension and your diabetes. And sometimes the hair loss that's very important to the patient doesn't seem as important to the physician or healthcare provider who's treating that person. And that's a shame. Sometimes it's because the physician or other healthcare provider is not aware of CCCA and so just isn't able to make an accurate diagnosis in time to treat the patient. In addition to needing to be diagnosed, the patient needs to be treated appropriately. So one of the problems we run into is that a lot of doctors and other healthcare providers hear scarring alopecia and they think, well, that's it. It's scarring. There's nothing we can do. And people tell that to their patients. Sorry, there's nothing we can do. And that's just not true. First, we can attempt to prevent the progression of the condition. And with CCCA, we can often slow or stop the progression with appropriate treatment. Second, sometimes we're able to achieve some hair regrowth. And that is because we don't go from active follicle to complete fibrosis overnight. So there's a bit of a gray zone when the follicles first stop producing hair before there's been complete fibrosis. And if we catch it in time, we can actually get those follicles working again. So it's actually important to be really aggressive and not dismissive with treating CCCA so that we can keep the hair that a patient's got and do our level best to bring some back. And the truth is sometimes that works and sometimes it doesn't, but I think everybody deserves a try.